Everyone that I talked to on my interview day didn't just feel passionately about the work, but also at the same time were actively engaged in it. So it wasn't like a bunch of people saying like, we find this really important, and then not following that up by action. It just seemed like their words and their actions aligned with each other, which I really resonated with.
What drew me to Minnesota's MedPeds program was predominantly the people. It's a university program, but it's very community-oriented. The people within the program itself are a community, almost like a family. It's a very collegial environment. The staff and other residents really nurture each other.
I think I was drawn to so many different aspects of the program. So I think some of the big ones would be that the patient population is really unique.
As far as internal medicine sites go, you're looking at Regents Hospital in St. Paul, University of Minnesota, University Hospital, and then also the VA. And then on pediatrics, you're looking at Children's Hospitals of Minnesota, either the St. Paul or Minneapolis campuses, Hennepin County Medical Center, or University of Minnesota Masonic Children's Hospital.
So we get to take care of Somali patients, we get to take care of Hmong patients, we get to take care of Latin patients. My clinic just is really almost like its own little global health hub, which is kind of awesome. I think another big aspect of the program that I really loved is kind of just like the social justice lean. Everything that we do is kind of based around advocacy and social justice and health equity. And I think that that really becomes kind of the foundation of everything that we do, and I absolutely love that. That resonated with me. Our program is one of the larger programs in the country, which I think is a huge strength for us. So I think that there's this kind of pervasive narrative about, you want to go to a smaller program, because a lot of the programs are 4 to 6 people. But I think one of the huge benefits of being in a program of 10, and in the case of our class 11, is that we graduate a lot of Peds residents. So that means that you can't walk into a hospital anywhere without meeting someone who was Peds trained.
Our program has been that large or around that size for a really long time, which means we have a huge number of graduates in the area. By and large, a large population of people doing everything under the sun.
I also think that from a resident perspective, what's really great about it is that means that there are just more people to hang out with. When there's 10 of you, there is a good chance that someone else is going to be available to hang out. So I view it as a huge positive. I can't imagine being in a class of only 4. That blows my mind. There's so much to do in the Twin Cities. If you are someone who likes to be outdoors, my goodness, there are trees, hikes, trails everywhere you look. We have lakes everywhere. We have a really fantastic food scene, theater scene. I've just been really happy here.